Thank you everybody again for joining us. As Meredith mentioned, I'll give a quick update here around what we are seeing with COVID-19 in Niagara and some of the announcements that we have for today. To begin though, I just again want to set the stage of where we are in terms of cases in Niagara. And as should be no surprise to all of you who no doubt follow our daily case counts, we are right now seeing a surge of cases in Niagara, which I think mirrors what we are seeing really across the province and around the country. And this is obviously not the direction we want to be headed. More worrying to me than just the daily number of cases is actually when we take a look at our deaths from COVID-19. And so we actually had a pretty good couple months in August and September, but as you can see in October, we had 7 deaths associated with someone with COVID-19. And already in November, we are barely 1/3 of the way through. We already have matched the number for October with 7 more deaths. And so, it is likely we are going to see that number increase further, and that's quite concerning. And that's exactly what we are trying to all avoid here. We, of course, are in currently the protect stage of the provincial framework, the yellow zone as it's color-coded. And I'm just providing here some of the updated data on what this looks like right now for us. You can see the weekly cases per 100,000 has gone up a little bit from 37 where it was last Friday when we spoke to now 44. It is a little lower if we take out the one large farm outbreak, which I think is something that is important to keep note of. The percent positivity is ticked up, so we are very much right at the upper margin of what the province would allow before we potentially move into a next range of the matrix. Our reproductive number remains 1.2. We've had 9 new outbreaks in the past week, and our public health and contact follow-up capacity remains pretty strained. And so those are all metrics that are not heading in the right direction. The couple glimmers of hope here, of course, is that our level of community transmission remains fairly stable and our hospital capacity remains stable. And actually, we've gone a good week now without anybody additional needing to be hospitalized. So that's at least a small positive measure that we're seeing at this time. Just on these metrics, I just want to take a moment to actually flip over to our website, just so everybody is aware that we've actually made some updates to our website so you can actually track many of these metrics. So our reproductive number graph has always been there, but we are now color coding that number to match the stage that range that we are in. So we are at 1.2, and that is now showing up as a kind of reddish color. We've added this number of new cases per 100,000 population per week to match what the province is doing. So you can see we have actually exceeded the threshold for the orange stage, and so we're showing an orange number there. We, of course, have our outbreaks, our hospitalization data, our public health system capacity data remains the same, our hospital system capacity remains the same, and unfortunately, those are largely still in the green, as mentioned. And then the percent positivity, we've added, again, the thresholds for the different yellows, the yellow, the orange, and the red. And you can see this is kind of a gold color signifying that we are currently still within the range of yellow. So just sharing that with you so you're able to hopefully keep track of that on your own for your own reporting. Getting back to the slides though. So, we are of course trying to, make sure that we don't continue to see these metrics worsen and us ending up in the restrict or orange zone. And I talked last week as well about some of the modeling done by the Public Health Agency of Canada, which showed this, where if we continue with our current behaviors in society, we will follow this great trajectory of ever increasing cases. And only if we cut down the number of close contacts we're having in society are we going to be able to bend this curve. And Theresa Tam at the Public Health Agency of Canada has come out and actually said that on average, Canadians need to reduce those social contacts by about 25% if we're going to be able to flatten the curve in that way. You've no doubt seen the messaging that we have been using for about the last 6 weeks about encouraging people to really limit their social interactions to just their household, to tighten up that social circle as much as they can, because reducing those numbers of contacts is how we're going to be able to keep the number of cases lower in our community. As well, if anybody has any symptoms of illness, that's absolutely something where someone needs to stay home, not be having any kind of contact with other people because they might have COVID-19 and they might be spreading it. When we look at our data, really our cases are rising, really linked to those two phenomena. People are having large numbers of social contacts, so when they do have when they do happen to have COVID-19, they're spreading it to many more people, which allows that large number of cases to propagate day to day. And many people are getting mild symptoms of illness, dismissing it as the usual seasonal flus that they would get around this time of year. But unfortunately, that seasonal flu this year could be COVID-19. And they're unfortunately therefore spreading the infection when they're most infectious, and again, causing more infections to spread. And so that's really ultimately what we absolutely need to be getting done here in Niagara, reducing the size of those social circles, limiting our social contacts, and making sure people are staying home when they have symptoms of illness. We've taken a deeper dive in our data, and as I showed last week, we can see that the group of people who seem to be spreading the infection the most widely are our young people in the 20s and to a lesser extent the 30s. And again, this is looking at the cases by week, noting that we are right now week 45 and we have not finished the week there. But nonetheless, we can see that that age group continues to dominate the number of cases that we're seeing. And of course, because we're not done the week, these numbers are likely still to tick higher up. So that trend is unfortunately is continuing. And when we do the deeper dive to break down that up to 40-year age group into smaller segments again, what we can see here is it's a bit of a busy graph, but you can probably appreciate that the yellow line and this red line have really been the ones that are highest. Last week, we did have a brief spike of this gray line signifying the ages of 15 to 19, which is linked to a particular outbreak. But again, this week, it is the yellow line and the red line that are dominating. And that is the group in the 20s who really seem to be our biggest driver of cases right now. I talked last week about how within this group, we are seeing large numbers of social interactions. People are spending a lot of time with their friends, with some coworkers of similar ages and socializing. And we saw with this young adult outbreak here that one of the key venues where that socialization is occurring is actually in bars, restaurants, and these sorts of food service venues, which are a natural place where people would be able to spend time together. Doing a little bit of a deeper dive into that data, we've taken a look at our bars and restaurants for the period of October 1st through to November 6th. Now, this is somewhat preliminary data, so it still needs to be cleaned up a bit. But what we look for is episodes of outbreak-like COVID-19 transmission in these kinds of settings, where one person was spreading infection to at least one other or perhaps many more people. And over the course of those 5 weeks, we have found at least 14 instances of this happening. Most of them have happened within that younger adult group. And so we are seeing this as being the single most important element in terms of infection spreading in our community after households. There's very little we can do about households, but we think there is an opportunity to hopefully reduce the spread of infection amongst people who are going to socialize in a bar and restaurant. I do want to emphasize at this point, though, that what we're seeing is transmission around people who are together at a table in a bar and restaurant. We're not seeing transmission between different tables or groups who happen to be at a restaurant. We're not seeing transmission between the staff people and the patrons or between staff people. It is very much a group that has come together to socialize at a table, and that's where the spread of infection is happening. And so the reason we're not seeing the spread elsewhere is I think for the most part, our food services operators are being very diligent. They're doing their best to make sure that they're protecting their staff and their patrons. And so they have the right physical distance in place. They have the right kind of masking policies in place. They have the right kind of disinfection policies in place. So infection is not spreading out throughout these establishments. But when people are having a close interaction at a table, the restaurant really can't do anything about that. And that is the opportunity where infection is spreading, and that is what we absolutely want to be trying to address. And so what we're outlining today is a few targeted measures to really try to get to the heart of this issue. And there's 3 parts to this. The first part of this, which you saw in the media release that went out this morning, is that we're making a much stronger recommendation to the public around limiting these kinds of social interactions. So we're re-emphasizing the importance that people should limit their socialization to only people within their own household, making exception for 1 or 2 people who are essential to people's mental or physical health, such as a caregiver or someone who lives alone and needs to have someone else who is a close social support. We are really emphasizing that message. We think that message is something that is not really broken through as strongly as it needs to over the past several weeks. And so we're hoping that by coming out much more strongly with this, we'll hopefully be able to get through. I note that both Halton region and just this weekend Peel region have had very similar public statements with letters to their community outlining this similar recommendation. We're also strongly making a recommendation to the public that if they have any symptoms of illness at all, they absolutely need to start isolating and not be potentially spreading that infection around to make sure that message breaks through and that nobody is missing that message. The second element of what we're doing is we're marshaling the support of our food premises to collect information which we think is going to facilitate these above behaviors actually taking place. And so that is, we're going to require food premises to make sure every patron is confirming that they're not suffering from a list of symptoms of COVID-19, to make sure that people who have symptoms of illness, who are the most likely to be infected with COVID-19 and to spread it to others, are not actually partaking in a social activity in the restaurant and putting others at risk. We're also having food services require that patrons attest that they're only going to be dining with their household or those 1 or 2 essential supports that we have outlined. And this is a way to make sure that nobody is not understanding that there's an expectation at this time that they're limiting their socialization to just their households or those 1 or 2 social supports. And this is one way we hope we can get better adherence to this recommendation in this highest risk setting of our food premises. The last element is that we're taking some measures to mitigate some of the additional risks that we have observed in food premises. So I've talked about most of the transmissions occurring at people who are partaking in a social activity at a table. And so we're going to require that food premises have hand sanitizer available at every table so that we can make sure that hand sanitization is occurring more often, and we're mitigating some of that additional risk of infection transmitting between those parties that have come together at that table. As well, we have occasionally seen some examples of employees who have had symptoms of COVID-19 and nonetheless continue to report to work while they have those symptoms, potentially putting others at risk. We think in some cases this is because we're, of course, dealing with people in the service industry who often are amongst our lowest paid people. And so they may be doing this because they have need of that income and can't live without that income. And we've certainly heard that voiced by a few of the individuals we've seen who've done this. And so we're going to ask our food services premises to make sure that employees are aware of the benefits and other income replacement options to them to hopefully reduce this action of employees working while they're symptomatic. Obviously, the ideal would be that every employer would be able to provide sick pay to these employees. We recognize that that might not be something that is viable for all businesses, so we have not mandated that, but that is something that we'd certainly encourage them to do if they are able to do. Obviously, the first item here is a recommendation. The latter two, we are actually making a requirement on our food services premises, and we're doing that by way of a class order under Section 22 of the Health Protection and Promotion Act. Both Middlesex London Health Unit, as well as Toronto announced earlier this week, have also done Section 22 orders on their food services premises. Toronto is, of course, taking much wider action and, in fact, using that order to ban all indoor dining in Toronto. We are taking a much more narrow and targeted use of that order at this time, targeted to what we see as the greatest risk of infection spreading. I want to highlight again that this is not something that we're trying to penalize businesses. I think it's regrettable that individuals are engaging in unsafe social interaction in the venues that our bars, restaurants, wineries, and other food services are providing. And that is unfortunately leading to the spread of infection that's putting our entire community at harm. We've worked hard to see how we can minimize this impact on businesses. So we did seek the input of business, and of course, that was something that did leak to the media, so you're aware that that consultation happened. And we've taken account their feedback and tried to incorporate every element of that feedback to make sure that this is least impactful on them. We've tried to make sure the requirements we're putting are narrowly tailored to the risk. And so it's narrowly tailored particularly to that risk of people socializing outside of their household at a table. It's also narrowly tailored to just our food services premises where we're detecting the greatest risk occurring. we're particularly not putting any limitations on businesses conducting their work. We're not putting limitations on the hours at which they operate or the numbers of people they might have in their premise. We're simply targeting that element of having people socializing outside of their household. And we heard from businesses that if they can have toolkits that make it easiest for them to implement that, that would ease their ability to go ahead with this. And so we're going to be providing them toolkits such as forms to collect this additional data, such as additional resources for educating their employees as well as the public, so that they have these tools to ease the ability to do that. Our hope is by taking these targeted measures now that we will be able to address this, continuing rise of cases that we're seeing in Niagara and be able to blunt it and flatten it out, and therefore protect the lives of people most vulnerable in Niagara from COVID-19, and make sure that by the time we get to our winter holidays in about a month and a half, cases are more under control, and there's an ability to actually maybe socialize a little bit more with one's larger family at that time. I also want to highlight that we're hoping that by taking these early measures now, we're going to protect our local businesses from the measures that might come if we move into the restrict range or orange range. And I highlight here that if this did happen, our food services premise would be hit with more onerous restrictions. They would now be limited in their hours of operations to only 10 p.m. They could only serve alcohol to 9 p.m. They would be only allowed to seat 4 people at any table. And I think that would be far more disruptive to their business than the early actions that we're taking right now. So we certainly hope that by taking these early actions now, we can blunt the trajectory of cases and prevent our region from moving into the orange or restrict range. The last thing I want to note is, I think this is really hard for everybody in our population. We have been dealing with COVID-19 for a good 8 months now. I think everybody is tired with living with the limitations of this, but unfortunately the virus doesn't react to what our emotions about it are, and it's continuing to act, and unfortunately it's continuing to cause people to die in our community. I do think, though, with the news we had earlier this week around Pfizer's success in their early results in their phase 3 study, give us hope that this may not be actually for that much longer. If this vaccine does work out as hoped, like the other vaccines that are using similar technology will soon get approval, we may be looking at some point in middle of next year where we actually have the vaccine and are able to vaccinate people. And so there is a hope that now that we could actually be at maybe the halfway point of this pandemic. And we just need to keep up our vigilance for a few more months, make it through to next summer when hopefully this vaccine is out. And if it is as effective as it's made out to be, and we're able to get most people vaccinated, we could actually be able to recalibrate most of our activities and start to emerge from the difficulty of this pandemic by that point. So that's the end of my comments, and I'll turn it over to Meredith to handle questions.
All right, thank you, Dr. Hergy. So now we will turn it over to our media guests. And as I said, I will put you off, or you can request to go off mute, ask one question and one follow-up. And we likely will only have time for one round today, but we'll see. So Richard Harley from Niagara Now, I will unmute you now.
Yeah, I don't really have any follow-up questions for that.
Okay, perfect. Thank you. So Abby or Bonnie, who's going to be asking for CKTB? Bonnie, okay.
Hi, guys. Thanks again for allowing us to ask questions today, Dr. Hergy. So I'm glad that you're taking these extra measures at restaurants. I know that I've been to a few restaurants, and depending on where you go, the rules are significantly different. And I'm not talking about, Fort Erie to St. Catharines. I'm talking about just in my own community. So have you thought more about enforcement? Have you thought about maybe creating a task force unit to make sure all bylaw officers are on the same page, involving police? Where are we on the enforcement? Because it just doesn't seem like that part of this plan has been addressed yet.
Sure, so thank you for the question. The first thing I want to highlight, though, is by and large, we're not seeing the measures that restaurants are taking to be the ones at fault leading to the spread of infection. It's not that they are not following certain rules and that's causing infection to spread. It is actually people who are coming and socializing with a wider social circle and perhaps many different overlapping social circles and causing infection to spread. And there's no rule against people going to a restaurant right now and socializing outside of their households. That is our strong recommendation, but there's no rule against that. So I'm not sure enforcement is actually going to be something that's going to help us necessarily bend this curve. That being said, we do perceive that there is opportunity for better enforcement. We do see, particularly when it comes to the screening of employees in workplaces, sometimes that isn't being done quite to the level that it should be. And so we've been working with the business licensing office at Niagara region, and because there are partners within the region, and they're really coordinating with all of the bylaw offices at the local area municipalities to come up with a more proactive and comprehensive approach to doing enforcement. So a lot of the enforcement has been complaint-based. They're hoping to try and make sure that we get out more to these settings proactively to make sure that this kind of proactive enforcement is happening, so we can make sure that these screening measures and other measures are for sure being followed. When it comes to bars and restaurants, that's of course something that we in public health, of course, already inspect in terms of food safety. And we have incorporated the COVID-19 measures as part of our usual inspections. Over the next few weeks, we are actually going to be prioritizing making sure that we get to all of these food services premises, particularly into the evening hours where we normally haven't inspected in the past, to make sure that they're aware of the new rules, make sure that they're following, and make sure that education is there so that there's high compliance. And after several weeks, we're not seeing that compliance, we would potentially move over to more onerous enforcement actions.
Yeah, I guess that would be my follow-up question is, you've issued I consider it a gentle reminder letter, just because we've been hearing this from you for months, I would say, right? This is the same information you've been telling us, limit your contacts to your own household. That's kind of like what we've already been telling our listeners for a long time. Have you talked to the regional chair, Jim Bradley, about maybe imposing different restrictions on the region to stop the spread yet? Is this a conversation you're having? So now that we're, targeting the restaurants, what's the next step? Where do we go to when the cases continue to rise?
Yes, so have talked to the regional chair as well as the corporation more broadly around what are the different options and why we've landed at this as the measure that we're taking. One of the significant challenges is that it's difficult to put a rule to apply to the public's behavior. It's much easier to put a rule on businesses. And so the rule, if you're going to make it really strong, would be that businesses would absolutely not allow people outside of their household to be coming and dining inside that. We, I think, are going a long ways there by having this requirement to attest, and we want to make sure we take the lighter touch before we really take measures that would be more harmful to businesses. I think if we see cases continue to rise at this point, we're probably going to move into the orange restrict zone. And at that point, there will be new restrictions on businesses. They will no longer be able to operate past 10 o'clock. Alcohol service will stop at 9 o'clock. People will be limited to only 4 persons per table. And that is going to probably actually do a lot more to break up that social interactions, but in a way that's going to be much more harmful to the ability of our businesses to survive. So we're trying to take an approach that tries to address this without actually hurting our businesses before it's too late and we actually do a trip into the restrict or orange zone.
Thank you.
All right, thanks, Bonnie. Over to Brian. I will unmute you.
Oh, thanks, Meredith and Dr. Hergy. So I guess last week, a lot of the discussion was around limiting social contacts. And this week, it seems a lot of the discussion was around some changes when it comes to food service and restaurants and bars. So looking at both those things, which one would you say is more impactful in kind of bending that curve? Is it kind of the limiting the social contact portion of it, or is it some of the changes that come on the food service side to limit those outbreaks?
So I would argue that these are actually the same issue we're trying to address. The requirements we're putting on our food service premises are really in pursuit of the goal to limit people's social contact. So I would see them as part and parcel. Overall, what's going to decrease our cases of COVID-19 is people reducing their social contacts in all settings, including in food services, but also what they're doing in their households, what they may be doing in other venues. I think food premises are this venue where we see the greatest risk right now and the greatest amount of infection spreading, which has necessitated us taking some more aggressive actions to try and limit those social contacts in these settings.
And follow up, Brian?
Yeah, I was just gonna say, it seems like the actions that you guys have chosen to take are, as you said, kind of very targeted at limiting the risk and trying not to be too harsh or overburden restaurants and bars. Is that basically to try to, at this point, prevent Niagara from entering that orange kind of restrict zone where the changes, and it's not by choice. It's now we're in a situation where restaurants and bars and other businesses are forced to operate in a more restricted way?
Yeah, I think our motivation is twofold. First and foremost, we're always looking at the health of our community and seeing the rising number of cases and the rising number of deaths. That's something that we absolutely need to be doing what we can to stop it. And so that, I think, is our first motivation. But absolutely, the second motivation is that we want to do that before we actually see more harm happening to our economy and to our community as a whole by moving into the restrict or orange zone. We talk a lot in public health about the social determinants of health. When people are employed, they have an income, that actually contributes to people's health. And when our economy is harmed, it's going to have an impact on people's health as well. And so we want to avoid that both in terms of their health, but just in terms of the vibrancy of life in the community. But our goal is twofold, that we need to change the trajectory we're on to make sure we're saving lives and protecting the health of the community, as well as protecting our local businesses.
Thanks.
Thanks, Brian. And Grant, over to you.
Okay. Good afternoon, Dr. Hergy. I've read the full Section 22 order that was posted to the Public Health's website. My question is actually related to consequences.
Mm-hmm.
Don't see anything in the order that says what will happen to a restaurant that fails to follow your instructions per Section 22. I mean, in terms of the recommendations themselves, these are the same as the ones that you had put forward to stakeholders last week. So my question really is, if your inspectors or bylaw enforcement finds that restaurants aren't abiding by this new series of rules that you framed around, what is the consequences to those businesses for failing to do so?
Sure. So in the first instance, in the early days, likely this would be an education approach. What we find with our public health inspections is the vast majority of operators want to operate within the rules. They sometimes aren't aware of the rule, they don't understand it, and that education provided will usually correct behavior. And so that's going to be our first instance. If we're seeing non-compliance where they're provided that education and they haven't corrected their action, there's really two routes that we can go. Number one, a Section 22 order can be enforced as an offense under the Health Protection Promotion Act through the Provincial Offences Court, and that is liable to a fine of up to $25,000 per day. That would be one approach. The other approach is that under the rules for Stage 3 regulation the province has, Regulation 364/20, I believe it's Schedule 1, Section 2, Subsection 2, it's a requirement that all businesses must follow the instructions of public health. And if they don't, they are liable to the fines through a ticket under that act, which would be $750. And so that would be the other opportunity that we have. An inspector could, at that moment, issue a ticket for a fine of $750 for violating the order, because that is an instruction of public health that was not followed.
And sorry, just for clarity there, before I move on to my next question, the $25,000 a day, that would be something your department would have to prosecute in court, and a justice would have to issue that fine rather than it being automatic as opposed to the ticket, correct?
That's correct.
Okay. And so the second part of my question then, Doc, is if those are the consequences faced by establishments, are there consequences to their patrons? You have been talking for weeks. You and I have had many discussions about that super spreader cluster, which hit 2 long-term care homes, 8 municipalities. You showed the graphic again today. There are specific instructions in this order. For instance, if I don't provide the information required, I can't dine. We know that there are groups of people in this community who have been trying to spoof contact tracing efforts. Is there any sort of consequence to a patron who shows up at a restaurant or bar with, say, 5 other people and says, oh, yes, we're from the same household, or this person or these 2 people are an essential, my partner who doesn't live with me, and it's a lie. and then later through your own contact tracing, you discover that these statements to the restaurant were not true. So are there consequences to patrons for skirting the rules or trying to spoof the system?
Yeah, one of the challenges with a Section 22 order, which is really the main power that we have in public health, is it typically can only be applied to someone who's actually infected with a communicable disease. So therefore, we can't really necessarily put that order on patrons. We would need to be looking at a different kind of legal instrument to put that requirement on patrons. That might be, licensing, I guess licensing would against e-business. That could be some sort of bylaw that could be done at the municipal level. We're looking into what those options are. Right now, we have not identified a way to go about that. The unfortunate thing is that the easiest way that we have the most power is actually acting through businesses. And I think we've seen both the provincial regulations, therefore build around businesses, as well as we in public health, when we act, it tends to be on businesses because that's actually where the legal powers lie. I think a restaurant is obviously always able to institute their own policies to go about and do what they might if they believe someone could be lying or perhaps have elements of validation. We have chosen not to require that upon our businesses at this time, given the logistics and complexity of that.
Thank you.
All right, thanks, Grant. And over to CHCH.
CHCH looks so muted.
Yeah, I have clicked the ask to unmute button and they are not unmuting. Okay, well, you know what? We will move on, but CHCH, either maybe put your question in the chat or we'll come back to you in a little bit. Penny, we will go over to you now. You should be good now, Penny. You're unmuted. All right, 0 for 2. Let's move on to Ludwig and see if we have any luck there.
Yeah, probably, hopefully. Hello, yeah, it's working.
Yeah.
Fantastic. Thanks, Meredith. Dr. Hergy, I might be a bit slow today, but take me through a restaurant visit now with the new requirements and regulations, and how, and if you could speak a bit about how that would differ from what we have been seeing before. What will a patron notice now with these orders?
So, sure. Let me take the example of, say, Ludwig, you and your wife, your kids, you're going to go out for a dining out in a restaurant. You'll arrive at the restaurant and the restaurant is already required to collect contact information. What will now happen is that, at least for you and your wife, not for your kids unless they are 16 years of age or older, you'll also need to attest that you do not have any symptoms of COVID-19. And you'll also have to attest that you are dining out only with your household and not from anybody outside of that household. After you provide that attestation, you will be seated. There'll be hand sanitizer available for you. You will go through the rest of your dining night out the way it would always occur. You'd order your food, you'd wear your mask until your food is served, take off your mask to eat, put them back on once you're completed, pay and leave. So the big thing would be just providing that information when you arrive, and also having hand sanitizer available at that table. Now, where it would differ is that, say, you decide that you want to go hang out with your media colleagues here of Grant and Brian, just to pick on them here. So the three of you will show up to the restaurant. You'll be asked those questions again. You hopefully have no symptoms of COVID-19 because you've been listening to my messaging all along to isolate if you do. But you'll then be asked to attest that you're dining out with your household, and you will, of course, note that you three are all from 3 different households. And so therefore, the restaurant will inform you that you're not able to dine with them. They'll likely provide you with alternatives such as takeout options for if you want to order your food and take it elsewhere to dine together, but you will not be able to be seated. So that's how it would play out for our customer.
And follow up, Ludwig?
There we go. Thank you, Doctor. And the second part of my question, we just see the numbers came in during this call here. Now we have, it looks like 20 new cases. And if you could give us a breakdown of basically where you have been finding those. And I have been seeing the numbers in Thorold have been going up steadily over the past week or two. I guess that kind of coincides with the general increase of the virus in the region. But if you could give me some specifics on what's happening there. Are we talking a household, or is there some type of outbreak there? I see we've topped 100 cases now with the historic total, and I think that's probably an increase of about 3 since yesterday. So if you could just give me paint a picture of the impact of the virus to spread just on this Thursday that we're having now.
Sure. I don't have specific data yet for today, but I'll speak about what we've seen over the last few days, which I'm sure is similar to the pattern that we're seeing today. Overwhelmingly, I think we are still having a lot of success with our contact tracing in public health, where we're able to trace people back to sources. So one of the things that does give me small glimmers of hope that we are able to flatten out the curve here more effectively than maybe some other regions is we continue to do better than the province as a whole in terms of cases that are able to be linked back to previous cases. We are around close to 70% of cases typically we can do that, whereas the provincial average is closer to 50 to 55%. In terms of the groups that we're seeing infections, it's really the group where I talked about earlier, where I showed that age breakdown, and it's overwhelmingly that younger age group, young adults, where we're seeing the plurality of our spread in the community. And with Thorold, I'd say those patterns very much hold. You're seeing a lot of infections amongst a young adult group. Those infections are tied to people partaking in social activities with wider social circles. And so the spread of infection, which we're fortunately then able to trace everybody back to because people know who they've been out with, as well then there's secondary spread that occurs because now those people go back to their household and the infection spreads to everybody else living in their households. And so many of these individuals, of course, in Thorold who have engaged in social activities, got infected, brought it back to their household, it spreads to the rest of their household, and that's driving some of those numbers higher up in Thorold as well as across Niagara.
Okay, thank you, Ludwig. So let's try to go back to CH and see if they can unmute. Going once, going twice. Nope. Okay, let's try Penny. Penny, it says you're unmuted. Nope, that's not working either. Okay, so feel free to put your questions, CH and Penny, in the chat. Meanwhile, we do have a few more minutes, so we'll go through another round to see if anyone has one more follow-up question. Richard, do you have a question?
Yeah, so with some other regions being in the restrict zone and, you know, I was seeing a lot of people come down to Niagara out of those restrict zones, is there any plan to ask businesses to, and I know the spread's not particularly between tables to staff or anything, but any plans to ask people that if they're coming from a restrict zone, even if they're in the same family or household, to say that no, you can't dine here because you're supposed to be in a restricted zone?
Yeah, we have recommended to the public that they be very cautious about traveling to other parts of the GTA where they are seeing much higher numbers of cases, because that's certainly a risk. And every day we do see, you know, 1 or 2 persons who has become infected because of the close contacts with someone who is from other parts of the Greater Toronto area. In terms of restrictions on restaurants, at this time, we're not moving forward with that, largely because we see it as being redundant. If people are going to be dining only with their household, of course, their entire household is living together in the same municipality within Niagara. And so therefore, there wouldn't be a need to also have another rule that people can't be dining from another part of the province. I suppose you could have a party from another part of the province coming here and dining together at a table. But again, that doesn't concern me as much because that would be risking people who are already in close contact with each other. So we've not seen that as a particular risk of infection spreading right now. And we don't see it as being necessarily to our order, given that the rule around the household, I think, takes care of infection from parties, someone outside of Niagara spreading it to people they're closely interacting with from Niagara.
Okay.
Thanks, Richard. Bonnie, over to you.
Hi. I guess my question is about hotels. Now that we know that Toronto will be banning indoor dining, we'll see more people coming down here to stay in our hotels and eat at our restaurants. So what will you be doing for the hotel industry to ensure that we're not seeing parties like we saw over the Halloween period happen over the holidays?
Yeah, it's unfortunate that we saw that Halloween party. And, from what we can gather, the hotel had no knowledge that this party was occurring. They had rented rooms out like any other, clients would be able to rent out rooms. And unfortunately, the people were using those rooms there to have parties, which is, of course, against the recommendation. And I think this is very similar to what we're seeing with our restaurants, where people are, not violating any rule per se, but they're using the freedom that's allowed to them in a way that actually puts others at risk. At this time, we don't see what rule could be added to hotels that would prevent that kind of activity from occurring. We've fortunately not seeing large numbers of those sorts of parties occurring, so we have less basis, I think, to put in place some new sorts of measures similar to what we put in bars and restaurants at this time. We'll, of course, be watching what we see from our daily contact tracing efforts, and we do see that as something emerging as a risk. We would start to take action against that as well.
What are some of the recommendations or restrictions placed on hotels right now? That, are there limits when it comes to, the amount of people per room, and are they being asked to be within their same household as well, same as restaurants?
Yeah, in terms of rules on renting rooms out, the province hasn't really articulated anything on that basis. Presumably, people staying in a room would likely usually be from the same household. Obviously, when it is used for a purpose like a party, that seems to have violated that in this case. So that's something we continue to watch for. Something needs to be addressed there. In terms of using the larger facilities, such as the halls, etc., within a hotel, those would be similar to the rules around gatherings that the province already has in place. Maximum of 10 people could be in any such gathering. There would need to be screening of all people arriving to make sure they don't have symptoms of illness. People in different households would be recommended to be seated separately within this gathering to make sure that they're not interacting with each other. So I think in terms of gatherings or booked events that might occur at a hotel, those are in place. I think in terms of the private rooms, there's less so. And I think when you venture into starting to regulate private abodes, that becomes, I think, a much more challenging place to put rules in place.
Okay, thanks, Bonnie. Brian, do you have another question? You're good? No? Okay. Grant, over to you.
Thanks, Meredith. Dr. Hergy, this is just a question for clarity. So you have to go to, when you go to a restaurant or bar, you have to confirm that you're either with your own household or one, I think it's a maximum of 2 people who qualify as an essential contact. Am I correct in assuming this is for people who, don't live with their significant other, or a parent or something along that nature, and it's just the 2 of them? So they're not physically in the same household, but they are part of that tight social circle, or are supposed to be.
Yeah, it's actually a little bit tighter than that. The way we phrase it in the order you'll see is someone who's essential for the physical or mental health of that person. So we're thinking particularly around, for example, a caregiver. You could have an elderly person who relies on a son or daughter to, do errands for them and provide them all kinds of support so they can continue to live independently. And we would see that as a group that already has necessary social contact that you really can't stop. And so it'd be fair for them to be out dining together. We also think about perhaps someone who's living alone, and to prevent social isolation, they're going to have at least, a couple other social contacts that they would continue to maintain. And we would see it being reasonable that they could continue to dine out. We're not necessarily seeing it as people through an extended family being able to socialize. We would discourage that from occurring. And I just note that the language around having, 1 or 2 essential supports is consistent with a lot of our peers around Ontario. Halton Region has included that in their public message around living household contacts. Both Peel and Toronto in the last few days has put out their own additional restrictions, and they've used that language around 1 or 2 essential supports. Ottawa has been using this messaging as well. So that's something that we're trying to take to recognize there's some reasonable limitations we have to make to just that household.
Unrelated specifically.
Over to CHCH. Let's try them again. Hold on, Grant.
Thank you.
Yes, Grant.
Dr. Hergy, not related to today's order necessarily, you may have seen the news out of Toronto last night and this morning, our colleagues at the Toronto Star, that the advice of Public Health Ontario was not accepted by the provincial government when they created this color-coded system. You've been, I suppose, a little bit cool in terms of your description of its effectiveness, at least at Code Yellow. You've said this isn't real, Code Yellow itself is status quo, it's not going to help us limit the virus. So given that Public Health Ontario has said it wanted to see much more stringent level of restrictions at these different levels, what is your assessment from a public health point of view of the system as a whole? Do you think that the measures and metrics and thresholds that it's put there are effective enough, or do you agree with Public Health Ontario that these measures should actually at each level be much stricter than they are?
Yeah, I've looked at the Public Health Ontario report itself, and I think it was less necessarily about how strict the measures were. I think it was more about what are the points at which you want to take action. And I think they were recommending that action needs to be taken at earlier points where cases aren't as high. I think the previous provincial framework was operating actually much more in alignment with what Public Health Ontario recommended. And if you actually take a look at what the Ontario Science Table has put out, and they have a website where they have this recommendation, their thresholds actually very closely aligned to what Public Health Ontario put out. Obviously, the provincial government and cabinet ultimately decided to take different thresholds. I can't speak to why they did that. I would certainly think that the Public Health Ontario and the Science Table thresholds made more sense to me, particularly when you're thinking that if you take more action earlier, you can hopefully blunt the run of the curve in cases later on. In terms of whether, the second part of your question of whether or not the measures are sufficient, I think, in some respects, the proof is in the pudding here. We had 4 regions move into the modified stage 2, which mirrors probably closest to the control range or the red zone of the new framework. It's not a perfect match, but I'd say that's probably the closest approximation. And we see on Peel in Toronto and in York region that actually didn't reduce their cases. They continue to go up. In Ottawa, they did manage to flatten out their cases, but they've actually not come back down to the 25 per week per 100,000 population, which was previously articulated as where they would need to go to move out of that range. And so I think we're seeing, these measures aren't enough. Even looking at us in Niagara, being where we are, it hasn't been enough to stop the increase of cases. And so additional measures, I think, are needed pretty much in most regions of Ontario likely to see the bend of the cases happen. That's why we've announced our additional measures today, because we think where we are with the provincial measures was not sufficient. We, of course, have seen over the last few days, both Peel region and Toronto have come out with their own additional measures, because I think similarly, they're thinking it's not enough. And of course, Middlesex London has come out with a series of Section 22 orders, likewise, because they want to have more stringent measures in their area.
Thank you.
Thanks. We will try CHCH again. So we'll unmute. And no luck. Okay, so we'll head on over to Penny and give Penny a try again. Yep, no luck from Penny, unfortunately. Okay, Ludwig, final one over to you. Oh, no, Ludwig has dropped off the call. Okay, well, that's it for everyone. Thank you. Thanks for joining us again, and we will look forward to do more of these in the future.